Okay, so this is the Nustep, and the purpose of the Nustep is to work on cardiovascular endurance. That for patients, we use it for like a quick warm-up for patients before their treatment starts, and we also use it for lower extremity strengthening for patients. This is a well grip, and it is used for holding a patient's hands on the handle, and it's just easy Velcro strips that we will demonstrate later in the video on how to put it on. But this is what it looks like, and it says Nustep on it, so you know that it goes with the Nustep. And then we also have leg attachments, and what this says is attach in, and then this is what we use to strap in a patient's leg when they can't keep it straight or aligned and they need support. And the same use with the hands. These are great for hemiplegic patients who are paralyzed on half of their body. To get the patient into the chair, there are two adjustments that you can do, and this back green handle, it just lifts up and it allows the chair to swivel side to side, just like that. And once you hear the click, you know that it's safe and secure and it won't move. And then the front green handle, that will push the chair up and down. And like I said, once you hear that click, you know that the chair is safe and secure. So now we're going to place the patient into the Nustep, and Maddie is going to be our patient. So what we will do is we will swivel the chair like this, and then we will come and have our patient sit in the chair. And then we swivel it back, making sure that the patient is safe. And if they need assist with the lower extremities, we would assist them. And once it's locked and secure, we can slide it down to the correct adjustment, and just like that. And she doesn't click, so there we go. And here are different number adjustments, and this is important for documentation. When you set up a patient on the new chair, it's important to put all the adjustments that they need for the Nustep into your silk note, so that way it's easier for the next person treating to set this up for them. And to adjust the arms, there's these green knobs, and all you have to do is twist them, and then they can just come out. If you want to grab it. Start.
Oh.
Alright.
Here, I thought I'd try to be helpful.
Alright, and then we will adjust the other side too. And again, there's measurements on these to document. Right. And then now we will have our patient start using the Nustep. And to adjust the workload goes from 1 to 10, and this is 1, and then it goes all the way down. It has clicks all the way down to 10. And what this does is it just makes the workload harder, or if you make the workload lower, it will provide less resistance.
Really working me.
Well, you're welcome. And on the screen for the Nustep, it will show the workload, it will show the steps per minute, it'll show the number of steps they've done, the time, and then it also does heart rate as well. So workload, steps per minute, steps, and then it can do calories and heart rate, but we don't have it set up for that. And then it also does the time, and you can also adjust the weight of the patient in kilograms, and just click and enter, and then that will all be in there for that. And then to reset it all, you just click the green reset button. now we will put on the adjustments to see how they actually go into the new step. So for the well grip, there's just a hole right here. Alright, and you can bring this back. Yep. And you just put this like this, because you want the patient's hand to slide in here. So we'll put it like this. Sometimes it's a little tricky. There it goes. Alright. And then we will have the patient slide their hand, or we will assist the patient with putting their hand in there. And then it's strapped on the other side. It just comes through, pull it through, and you Velcro. And pull this around, and it comes through, and it Velcros there. And that is how you keep their hands stable and safe. And for the leg adjustment, you take this pole right here, and there's another pole where it inserts, and you just put it in there, and then you click the button, and you want to make sure it clicks, just like that. Make sure it's safe. And then there's adjustments on the side right here. So for the patient to, depending on how long the patient's legs are, our patient's isn't very long. So to attach it to Velcro, it's the same concept as the well grip. It's just Velcro. There's two straps, two sides, just one each side. And that supports the leg so the leg can't go anywhere. And now the patient is able to also use their affected side on the new step to strengthen that lower extremity and to work on that arm motion.